for joining with us to celebrate this Women's Day campaign. This is Dr. Ruhina, who is one of the team doctor of Lotus Hospitals, inviting you to for today's talk. So, this is our second session as a part of Women's Day campaign. I'm excited to introduce our Dr. Deepti, who is one of the consultants of the gynecology department at Vizag branch. So, hi, ma'am, how are you?
I'm good, Ruhi. Thanks a lot for the warm introduction. I see that your last session was a great success. I'm so glad you invited me over for this session.
Yes, ma'am. As all of you know that we in last session we have discussed about a challenging phase of life, that is adolescence. Now we are going to talk much more about another challenging phase of life, that is the childbearing age, where the mothers are being ready to get their start their motherhood, right? So, Dr. Deepti is one of the consultants, and she has been specialized in her infertility and laparoscopy, and she has specialized in her cosmetic and functional gynecology. So, I'm very happy and very excited, ma'am, to have this interactive session. Thank you. Thank you so much for joining us for this session.
You're welcome, Ruhi.
So, can we just let's start our discussion on this? I mean, I have a questionnaire for you. Women, this is the childbearing age where every woman dreams to be give birth to her childhood. Give birth and want to face a good feel of giving a birth, and also that during this period she have to stay strong and healthy to face to balance her this personal as well as professional life, and she should be part to just begin new beginning of her life. So I have a first question for you, ma'am, and that how the woman should prepare herself to enter this journey of her life.
Like you said, motherhood is definitely one of the most precious stages in every woman's life. When it comes to preparing oneself regarding having a baby, the preparation I would say is physical, mental, as well as financial. Physically, she has to be in good shape. And by that I mean she has to be healthy, should not have any, anemia or any other health concerns. In case she does have health concerns, she should talk to her gynecologist so that we can optimize that condition. Let's say if a woman is already diabetic, okay, let's say juvenile diabetes, something from childhood she's been suffering. Before planning to have a baby, they should go for a preconceptional counseling, talk to the doctor, where the doctor will take a detailed history, will try to identify the issue, optimize the medication as well. If any dose changes are required, that can be done. Or there are certain medications which are usually not very safe in pregnancy, so that needs to be withheld. So a detailed discussion will be done, and in case the doctor feels that there is some difficulty, in case any blood test or an ultrasound scan is required, that will be advised as well. And usually preconceptionally folic acid is something which is advised to prevent deformities in the developing baby's brain and spinal cord. We usually advise it even before conceiving to up till at least 13 weeks into their pregnancy.
Okay, ma'am, that's
And
nice.
when it comes to mental preparation, they should be in a, mentally also prepared to have a baby. Like, let's say women of this generation are, prioritizing their careers, which is good thing. It's individual choice whether you want
Yes.
to prioritize motherhood or your professional life. So they have to be ready there, and also financially, especially this holds good for those who are trying to have second child, third child. Only when you think you will be able to provide that kind of environment for the baby, when you are ready, you can embark the journey.
Yeah. So, what do you think? What is the healthy weight in the pregnancy?
Before
Hmm.
talking about healthy weight in pregnancy, we should talk about healthy weight in a normal woman. That is like even in a non-pregnant state. So there is no one size fits all concept. Mainly the healthy weight will depend upon the height of that particular person. So that's where we measure something called as body mass index,
Yeah.
wherein it is a weight to height ratio. Normally we say 18.5 to 25 roughly is the healthy BMI. So in a woman with a healthy BMI, usually we advise about 10 to 12 kg weight gain during pregnancy. But let's say a woman whose BMI is on the higher side, like say morbid obese or obese women, BMI more than 30, in such cases it will be very individualized, wherein a dietitian opinion will also be sorted and the needs will be told to her with regards to healthy weight gain.
So many women will be having conscious about their body image. So can they do diet in that pregnancy?
Well, I must say it's a big no diets in pregnancy, because see, the whole reason why a woman gains weight in pregnancy is the nature's way of taking care of that, providing for that growing baby in the womb as well as for lactation. The nature is preparing the body for that. So if you are trying to lose weight and trying to contradict the nature's way, you are in a way going to harm the baby's growth. So once the baby is delivered, once you have taken care of lactation, definitely you can work on getting back to your normal shape. It is absolutely doable. We have seen so many film stars like Karina or the Queen, Meghan, all of these people have been doing it, okay?
Yeah. So that is that, and many are worried about taking the vitamin supplementation during the pregnancy. Do we really need to take those?
See, when it comes to vitamins and minerals, all in all, about 13 vitamins are extremely crucial, which have been identified, of which I want to list out a few which are absolutely mandatory in pregnancy, like let's say folic acid. Folic acid is prescribed even before women, conceives, that is preconceptionally itself we start folic acid. The whole reason behind that is to prevent neural tube defects. By neural tube is a structure which eventually grows into brain and spinal cord. In order to prevent deformities there, like say anencephaly, spina bifida, we routinely prescribe a dose of 400 micrograms for all the women. There are a category of women for whom we will be prescribing a higher dosage, like 5 milligrams, depending upon the individual, like if she has had a previous history of this kind of defects, or if she's having fits, that is epilepsy, or she is a strongly diabetic woman. In such cases, a high dose is prescribed, but definitely folic acid is a mandatory vitamin which needs to be taken. And another vitamin is usually vitamin D.
Yes.
Though, yeah.
When we have to start this folic acid, how many how many months or
See,
prior?
ideally, if the woman is coming to you for preconception counseling, that is even before she has conceived, in that case, we say 3 months prior to pregnancy, or at least 1 month prior to embarking on the pregnancy, and it needs to be continued definitely till 13 weeks of pregnancy, because that is the time where major growth happens. Now, suppose let's say the person has come to you at about, like, once her urine pregnancy test is confirmed, let's say she's about 5 weeks, 6 weeks, even that is the right time to start. You have to start it and tell them the importance of folic acid. Okay.
What is the importance of vitamin D?
Well, vitamin D is very important for the mother as well as for the baby. Like we all know, it has major role to play in bone health. Though it is freely available in the sunlight has it, by the time our body processes it and it is available in the body, it might not always suit up to the recommended doses. So what happens is, in pregnancy, the recommended dose is about 10 micrograms per day. So we usually give them vitamin D supplementation also.
What are about this iron and calcium?
Well, when it comes to iron, see, in a country like India, where a lot of iron deficiency anemias are seen, so the government recommends that all the women be advised iron tablets in order to, cater to the increased demand of iron in pregnancy and during the childbirth. At the time of delivery, definitely there's going to be some amount of blood loss.
Yeah.
But again, though we routinely prescribe iron, the dosage of it keeps varying based on the initial hemoglobin of the women. Let's say if the women's hemoglobin is on the anemic range, like say 9, 8 or something, then probably a higher dose will be recommended. But if it is being maintained in a normal range, so just like a prophylactic iron therapy is suggested.
Okay. So many women will be worried that if they have any bleeding or any pain in the first few months, when we have to go for the gynecologist.
Right. Ruhi, I must tell you, women are very terrified the minute they
Yeah.
know they're pregnant and they see even a small bit of spotting, or let's say a good amount of bleeding, they are so terrified. First thing is, like you said, in the first few weeks, once the pregnancy is confirmed, the things we are mainly concerned about is some amount of bleeding can happen in the natural process also. That is, when the growing baby is trying to attach itself to the uterus, the womb, there can be small amount of bleeding, what we call as implantation bleeding. That is harmless, nothing to be concerned. Another reason where we can see bleeding is where probably that pregnancy is heading towards miscarriage, what we call as threatened miscarriage. In the sense, miscarriage hasn't occurred, but there is a high chance that it can occur. And another one is where inevitable miscarriage, that it is already into the process of getting miscarried. That is one thing. And another dreadful condition, what we call as ectopic pregnancy, wherein the pregnancy is not being developed inside the womb, but it is elsewhere, be it the tubes, ovaries, or anywhere in the tummy. That is when we call it as ectopic pregnancy. So in the initial few weeks, especially less than 7 weeks, 8 weeks, when there is no prior scan available, if a woman comes with bleeding per vaginum and pain abdomen, that is one of the cause. We definitely keep behind our mind and take it forward.
So you mean to say whenever they conceive, as soon as they conceive, they have to consult the gynecologist so that they confirm the pregnancy, and they have to get the pregnancy test then. And when should the first scan to be done?
Well, see, one thing is, once you know that the urine pregnancy test is positive, it is always good to go and meet a gynecologist, because they will really help you, be it taking a detailed history where they want to identify if there are any factors that can harm the growing baby, like if the patient already has thyroid, or patient already has diabetes, or already has fits, or something like that. And initial weeks, they always suffer from symptoms like nausea, vomiting, inability to eat, constipation. So they will start getting terrified and worried, what is this? Because they are also new to these changes, they should also get used to it. So yes, once your urine pregnancy test is positive, go talk to the doctor, because one thing, she will take a detailed history, and if there is any changes that need to be made, they will be told to you. Medications will be added, like folic acid, like we discussed earlier, or a bit any symptomatic, like if you are having nausea, vomiting, that can be dealt with. And then like you asked, when should a scan be done? That depends that depends. One thing is, the initial scans which we do is called as a viability scan. Why we do it is, first thing we want to see is whether the pregnancy is growing in the womb, and then whether it is a single pregnancy or a twin pregnancy that is happening, and whether the heartbeat has come in or not. That is, usually it comes around 6 to 7 weeks of pregnancy. This is roughly, okay, we have our technical terms for that. And another reason is, in women who are not very sure of their last period, that will in a way help us in dating the pregnancy also. So the first contact that happens with the gynecologist once you have confirmed your pregnancy is what is called as booking visit. And booking visit is extremely important in the journey of pregnancy.
Yeah, that's very good, ma'am. And what are the vaccines that are safe in pregnancy?
See, vaccines that are safe in pregnancy are, first and foremost, we all have seen the kind of havoc COVID has created. So I would say to all women, whether pregnant, non-pregnant, lactating, not lactating, go ahead and get your COVID shots. Complete the course, because getting COVID is a lot more dreadful than anything else. So COVID vaccines are safe in pregnancy and lactation. Apart from that, during the course of pregnancy, we usually recommend a flu vaccine, which can be taken at any period of pregnancy. It prevents from all the flus and the symptoms associated with it. Because if a woman gets flu during pregnancy, the kind of morbidity, in the sense, like the kind of difficulty she goes through is usually a little exaggerated. So that's the reason we recommend. And another very, very important vaccine is Tdap vaccine.
Yeah, you're going to talk about Tdap now.
Right. So when it comes to Tdap vaccine, it is basically three organisms we are targeting, that is tetanus, diphtheria, and pertussis. It is recommended between 28 to 36 weeks. The reason being, see, normally when the baby is born, you know DPT vaccines, right? Which we
Yeah.
all give to the babies at 6 weeks, 10 weeks, and 14
Yes.
weeks. The first vaccine is given only at 6 weeks.
6 weeks.
So, how are we going to protect the baby in the first 6 weeks? In order to deal with that, what we are doing is we are giving this vaccine to the mother between 28 to 36 weeks. So, in the meanwhile, when the antibodies form, they will be transferred through the blood passively to the baby so that the baby will have an extended protection even during the first 6 weeks. So that is the reason Tdap is given at that point.
So that is why it is protected. That is why it is safe to take Tdap in
Yes,
pregnancy.
absolutely.
And it's important also,
Right.
right?
That's right.
And we have talked about the dating scan, that is the viability scan. And what are all the other scans that can be done in the pregnancy? That is like NT scan, we have heard.
Right, right. Yeah, NT scan is a very important scan. Mainly what happens here is, this is nothing but a nuchal translucency is what looked at in the scan. Roughly, we will say from anywhere between 11 weeks to 13 weeks, 6 days is the time of pregnancy where this NT scan is advised. The whole point here is a skin fold thickness at the level of the neck is measured in the scan along with other parameters like the bone in the nose and stuff like that. So the reason why the scan is being advised is there are certain chromosomal anomalies in the babies, like say trisomy 21, which is Down syndrome, trisomy 13, 18. These, if at all there is a chance that baby can develop, we will be able to identify those fetuses which have a probability of having this condition. So we usually advise a NT scan, and along with it, in order to increase the sensitivity of the whole test, we will advise something called as double marker, which is a blood test which mainly measures 2 hormones in the blood. Both of these clubbed together will give us a good sensitivity. Whatever said and done, these are only screening tests,
Yes.
okay? So they give us a sensitivity, the chances of that baby having these particular chromosomal abnormalities.
These have been, we are going to know about these things more because the age of pregnancy has been increased, right?
Yes, yes.
Because previously they used to conceive at the age of 18, 19, hardly 21, they used to complete their families also.
Right,
Now
right.
it has been increased
Yeah,
to
yeah.
about 30, 35 like
That's
that.
right, Ruhi. Like you said, advancing maternal age
Age.
is one of the reasons why there is slightly increased risk of babies having chromosomal abnormalities when compared to general population.
Yeah. And we have heard something like TIFA, this anomaly scan.
Yes, yes, that's
What is
right.
the importance of that?
See, anomaly scan is a very important scan. Like the name suggests, it's anomaly. Like TIFA scan is what? It's a targeted imaging for fetal anomalies. So anomaly is a birth defect. A defect, anything which is not normal is a defect. So in anomaly scan, usually the baby will be checked from head to toe. All the parts, like all the systems, be it the heart or the brain or the muscles, bones, everything will be checked in detail to see if there is any chance of that baby having any birth defects. In case anything is identified, a further testing will be advised to them. This anomaly scan is usually advised anywhere between 19 to 21 weeks of pregnancy.
Oh, yeah, we all got information regarding the scans and when they have to get it done and all those things. So, and what if we miss these screening tests, like you said, first trimester screening and this dual marker, triple marker, and what if we miss these tests?
Well, see, in case these tests are missed, it depends on what period of pregnancy you're coming. Like, say, like you are going to come back, like, say, at 16 weeks or 17 weeks, then instead of a double marker, we usually advise a quadruple marker where 4 different chemicals are tested in the blood, which will help us know if at all the baby has any, chances of developing any anomaly. And that is usually clubbed along, and we have the anomaly scan also. So together we will probably get an idea whether, the baby, if there is any chance of having any difficulty, any deformity.
Yeah. Nice, ma'am. Nice. You are explaining elaboratively so that everyone can have that information, right? So there are many other problems also. The women go through this age, they have difficulty in urination, or there are problems during urination like that. What are the
See,
problems
the
they have?
most common problem women face is urinary tract infections. Now, by urinary tract infection, like the name says, it can be infection anywhere from the kidneys, which produce the urine, or all along the pipe that carries it, or from the bladder or the outlet. So all of these put together, we usually say urinary tract infection. Women are relatively more likely to develop it because they are anatomically made that way. The pipe that carries the urine out, what we call as urethra, is slightly shorter in women than when compared to men, and its close proximity with the vagina and the microorganisms there, sexual activity, all those somehow contribute to women having urinary tract infections more frequently.
Okay, how to get rid of these things? Like, what are the treatments? Like,
Right. Before we go ahead into treatment, what's important is the symptoms. The
yeah,
symptoms wise, in case they have burning while passing urine, or they are having to use the washroom very frequently, or they have pain while passing urine, or in spite of passing urine, they feel that it's still there. You know, they don't have that feeling of completion. And in severe conditions, we also see fever with chills and pain in the abdomen, backache. All of these are some of the symptoms of urinary tract infections. Okay, so normally when a woman has these kind of symptoms, they should definitely visit their doctor, where a complete urine examination will be done, and when identified with infection, antibiotics will be given to get rid of those organisms.
yeah.
And rest of it will be symptomatic approach, like we will be giving some of the syrups to alkalinize the urine and advise them on their general health. This is how we usually do treat UTIs.
So all of us came to know that how to get rid of this
Yeah,
urinary
but
tract
I want to
infection.
add one extra point is how to prevent UTIs, because
Yeah.
like I said, it's very common in women, right? Some measures to prevent it is all women, whenever they think that they have a sensation to pass urine, try to do it immediately if the conditions are feasible. Don't make it a habit where you keep postponing it until a point where you have to pass or is just going to break. Do not do that. Whenever there is an opportunity, when the conditions are favorable, just use the washroom at the earliest. And another thing is passing urine before having sexual intercourse, or passing urine after having intercourse at least within 30 minutes. All these are some of the measures which will reduce the contamination with the microorganisms in that area. And also drinking lots of water. These are some of the measures that can be taken to prevent urinary tract infections.
Yeah, these are the preventive measures, right?
Right.
And so, as I have introduced ma'am that she has been specialized in the cosmetic and the functional gynecology.
Yeah.
So, can you just tell us and elaborate on that, ma'am? So, what does this mean?
Definitely, Ruhi. This is one of the upcoming branch, and as a woman, I personally feel that it is going to help womanhood of in various ways. All women in various age groups, it's going to help. Firstly, I will talk about the functional aspect, like especially when we see women in the menopausal age group, that is women in whom the periods have already stopped. Roughly category, we can put them across like about 45 years of age. In such women, they find they have a lot of difficulties, like they usually complain of a constant burning sensation there, even though when there is no infection.
Yeah.
And then there is something called as stress urinary incontinence, which is a very, very nasty thing. Women absolutely lose their confidence when they have this. What happens here is, whenever they cough, they sneeze, or try to do smallest of the small exercise, they leak. So this really takes a toll on women's health. In such conditions, we can treat them with depending upon the severity. In the initial stages, we tell them some lifestyle modifications like weight loss, and we look at what they are eating. If there's too much consumption of coffee, alcohol, we try to stop that, and then we'll advise exercises. Along with that, we can use platelet rich plasmas in enhancing the health down there, which usually becomes as they age, like how we see wrinkles on our face, the tissue down there in the vagina, in the urinary area also tries to become lax. So we can fix that, and then we can use lasers as well in treating that. That is when it comes to menopausal women. Now there are these women who have pain while having sex, what we call as dyspareunia. This is again of two types. One is primary, that is from the very beginning they have it, or once after childbirth they face. In such women also, there are multiple ways of treating. Either we can do PRPs, we can do Botox, or we can actually go for laser therapies. We can help them rejuvenate the vagina. The dryness can be dealt with, which reduces the pain while having sex. Actually, what happens with this condition is these are day-to-day problems, and
Yeah.
a lot of women go through it, but they're very shy to talk about it.
Yeah.
They're embarrassed to tell ki, you know, they leak urine when they cough or sneeze, or they will tell some of their friends and they'll say, "Ha, hota hai, even we have it. Ala autundi, parvaledu, age to chimi." No, you don't have to suffer with that. There are ways where it can be dealt with.
Yeah.
Okay, so this is the functional aspect of it.
So many of will feel shy, as you said, like that.
Yeah.
They are very shy and very like low to tell their problems and to come to a gynecologist. So guys, we have our cosmetic and a functional gynecologist who can help with these things, right? No need to stay
Yeah,
at home.
absolutely. Please don't feel shy. It is a problem which needs to be dealt with, and it is your right to stay healthy. So
Yes.
seek help.
Yeah, definitely, definitely. So,
And I wanted to just add a point on cosmetic part as
yeah,
well. When it comes to cosmetic part, what happens is a lot of women, again, for various reasons, they feel a little, you know, low self-esteem, etc., thinking that their intimate parts are on the darker side, not in par with the rest of the skin. In such cases also, we have peels, we have, you know, laser lightnings which can be done in the intimate parts. And as aging happens, like how there is a loosening of the skin on the face or rest of the body, that happens even down below there. So in case they want a vaginal tightening, that can be done, and you know, labioplasty, wherein the intimate structures, when they think that they are not in the right shape and that is affecting their self-esteem, they all can be fixed as well.
yeah, yeah. We have very informative talk and when to get come and let's consult ma'am whenever we have these kind of problem and whenever we see our relatives or someone who is going to these problems. Okay, right, ma'am. Then what? Like I want to say that we have heard this name as a household name. Everyone will be anxious about this. That is nothing but the PCOS.
Oh, yes.
Yeah. What does that mean and what are the symptoms we are going to see with this PCOS?
Actually, Ruhi, I'm also quite surprised these days, you know, because earlier, like say 10-15 years back, when I just started practicing, PCOS was something we used to see more in the childbearing age group and things like that. But right now, from the adolescents, we are seeing this PCOS, which is nothing but polycystic ovarian syndrome. And like you said, it has in fact become a household thing. So what happens is PCOS is a condition which mainly affects the periods, the hormones, and one's ability to conceive, that is the infertility aspect of it. And it also has long-term implication on women's health. So in PCOS, what happens is the size of the ovaries are relatively larger than the normal ovaries. That is because there are the small fluid-filled cysts, like what's a small fluid-filled bags are present inside the ovaries, which are increasing the size of the ovaries, causing hormone imbalance and the ability to release the egg, which is the actual function of the ovary. So that is what is PCOS.
Okay. What I mean, like, what are the symptoms we can actually encounter?
Right. Symptoms, the most common symptom we come across is irregular periods. Like they come and say, it's been 2 months, 3 months, they didn't get their periods, or total absence of periods is also one possibility, which we call as amenorrhea. And then women come and tell that they're developing a lot of body hair, be it on the face, what we normally call as hirsutism, rest of the body like hands, back. And then they say ki, there's a lot of hair loss. That is one thing which is very concerning.
And also a lot of pimples,
right,
like
pimples, acne, oily skin. And another thing is these girls, a good number of them are overweight per se, or they also identify a rapid increase in their weight, or their weight is on the higher side and they find it very difficult to lose weight. So this is one thing. And like we discussed, fertility issues, difficulty in having a baby. These are some of the symptoms we see in women with PCOS.
So what is the treatment for this PCOS, ma'am?
Well, honestly speaking, there is no treatment for PCOS because this is a lifestyle disorder. By lifestyle, I mean to say the change in the food habits, sedentary lifestyle. These are the things for which has brought in this. By saying that, I'm not discouraging or disheartening anyone. We can definitely optimize it and keep it under control. So the number one treatment for it is lifestyle modification, lifestyle modification, and lifestyle modification. I cannot emphasize enough on maintaining a healthy lifestyle. That is eating a healthy, balanced diet. Along with it, doing exercises, by which I mean at least 45 to 60 minutes a day for 5 days in a week. And of this, let's say 5 days a person is exercising, 2 days should definitely include strength training. That is very, very important. What exercise does, like everybody might think, how does this going to help me? The thing is, it is going to regulate the hormones. And research has shown that even 5% loss in the body weight, okay, is going to regularize their periods and increase their ability to conceive, which are the main concerns with which the women is coming to us. Apart from this, we also have medications.
Yes.
And medications are extremely customized, individualized. It depends. Like say a woman comes to us, she wants to have a baby. So our aim is in that, let us helping the ovaries release a egg. So we give medications which will increase in what we call as ovulation induction, which will help in formation of the egg, and we will be following it up with serial scans. That is done. Now suppose a woman comes, her concerns are regularizing of periods, she has facial hair and things like that. We will give them medications, which is usually a combination of hormones, which we advise in order to regulate that hormone imbalance. But along with all these, number one which has to be emphasized is lifestyle modification.
Right. So guys, why we have to do exercise is nothing but to regulate our hormones.
Absolutely.
Right? So, because PCOS is one of the causes for the infertility, right, ma'am?
Right.
So we have to get rid of this thing. And what are other causes for the infertility, like inability to conceive?
Right. Before we go into the causes for infertility, I want to tell one thing, okay? Right now, we see a lot of couples who are not planning to have a baby immediately. And when they want to have, when it doesn't happen immediately, they tend to get very anxious and, you know, they start doubting themselves, they go very low on their confidence. First and foremost, before labeling a couple as infertile, what we normally say is they should have unprotected intercourse for at least 1 year. Okay, it's just not, it's not some, you know, it's not some cafeteria approach where you just go, yeah, I want a baby, so you're not going to bear immediately, right? So it is a process, it is a very natural process. So unprotected intercourse for at least 1 year, and in spite of that they are not able to conceive, that is when they have to seek help. This I'm talking about regular age groups. Like suppose a woman who is coming to you at, like say, age of 39, 40, we usually do not give 1 year time because her biological clock is ticking already, right? So that way it is, in medicine everything is you know, quite customized. There is no single thumb rule for everybody, but this is the general nature. And one other thing I want to tell is, like with the increasing stress, be it at the level of, you know, workplace or home stress or travel journey, whatever it is, it's very, you know, I actually see people who come and say they hardly have sexual intercourse. So how are you going to even conceive? So trying to develop that kind of rapport with your partner, both at an emotional level and physical intimacy level, will also reduce the stress levels and somehow optimize you the chances of having pregnant. Okay.
Yeah, is there any male causes which we really have to worry about? What are the contributions of the male for this infertility? Like, what are the causes?
Yeah, definitely. Male has almost like, let's say 30 to 40% is contributed by the male also. So when it comes to causes, it is at various levels. Mainly stress, then thyroid issues, and there can be even organic causes where the sperms are not produced enough, and you know, or the patient has some problems with erection, ejaculation, and then other medical disorders like the thyroid, diabetes. So first thing when we are approaching an infertile couple is get a semen analysis done. so that you will know the parameters, and from there you can take it.
So there is an equal causes, like female and a male has an equal
Yeah,
thing.
absolutely. When it comes to infertility, the role, I mean, like female causes around 30-40%, male 30-40, mixed is around that. So unexplained is about 10%. So we definitely, like, we are all equals, whether we agree or not, because the sperm has to come from the male and the egg from the women for the baby to be, formed, like for the fertilization to occur.
So both the couple has to come for the
Absolutely.
to get evaluated,
Absolutely.
right? Yeah, ma'am, it's a very nice session we are having now. So we have some questions from our viewers.
Okay.
So let us answer those questions.
Sure.
One, yeah. So we have one question from one of our viewers, ma'am. It's that what are the exercises that can be done during the pregnancy? Is it we have to start, or we can do any exercises?
So what I would say is that depends on your body. Like suppose you have been into exercising all the way, like even before you got pregnant. In that case, you can continue doing your exercises, but you need to do those which are safe in pregnancy. Anything, a moderate exercise can be done. And for those women who are not into exercising, but it is for the general health during pregnancy, what we normally advise is to start off when they are comfortable. Usually once they are pregnant, by the time nausea settles down or their weakness settles down, it's usually around 10 to 12 weeks. So if they're comfortable, they can start then. Since they are new, they can start off with simple ones like walking and exercises like that. Even swimming is safe, those can be done, and slowly you need to build it up. You can eventually do squats, you can do Kegel. All of these will help in increasing the pelvic health, pelvic floor health. That is the muscles which guard the female organs. So yeah, those can be done.
Yeah, ma'am, nice. So we have another question, ma'am, that is it safe to travel in pregnancy, like air travel? They have so many doubts regarding when to travel, like that.
So that again depends. When it comes to air travel, if people are talking in there was a time when they used to believe when they're traveling there are a lot of ionizing radiations which can harm the baby and all. No, those are not considered reasons anymore. But what makes a huge difference is for how long are you traveling. Whether it's a short flight, like let's say if the flight journey is less than 2 hours, 3 hours, nothing to worry. You can travel, hydrate yourself, and you can travel. But if the flight journeys are longer, like if you're traveling intercontinent or a different country more than 6 hours, in that case also they can travel, except that they have to take extra precautions. See, mainly what happens is in pregnancy there is a lot of changes in the body that occurs. Even the blood usually thickens up. So when they sit for so long, there is a risk that clots can form in the legs, okay, in the blood vessels of the legs. So in order to prevent that, again another important contributor there will be her body weight. And other risk factors. So she needs to discuss with her gynecologist and take necessary precautions like hydration. Try to walk even in the flight at the end of every 1 hour, 2 hours, and if required, wear stockings. And if at all she is considered into a very high risk of having thromboembolisms, heparin injections, which are blood thinners, might also be advised. So she needs to talk to her gynecologist depending upon that. But in general, short flights and all, they can travel,
right? Thank you, ma'am. Thank you for answering our questions of the viewers also. And we have a last question. So you have said about the scans during the pregnancy, right? So there are some people they are asking that are the so many scans needed in pregnancy? Is it safe to have so many scans? And how many scans are at least required?
Okay, so first and foremost, I want to make it crystal clear that ultrasound scans are safe in pregnancy. They do not cause any harmful effects, let's say like CT scan exposure or X-ray exposure. The kind of effects that has on the baby are not seen in ultrasound. So that is the reason ultrasound scans are in fact advised. They are absolutely safe. So please remove that fear from your head. And when it comes to scans, well, I will just tell you, in a low risk pregnancy, that is when there are no other risk factors, it is a straightforward pregnancy. Normally we do a viability scan in the early weeks just to check at the how many weeks the pregnancy is, whether the heartbeat has come and whether it's in the uterus. Okay, then the NT scan is done, a anomaly scan is done, and a growth scan. So roughly that comes to 3 to 4 scans in a low risk pregnancy. But let's say we are talking about a high risk pregnancy, like a woman who is at a very high risk of developing IUGR, she has blood pressure in pregnancy already, she is diabetic, and or the length of her cervix, that is the opening of the womb, is very short, where she is at a very high risk of having a premature birth. In such scans, they are very individualized, and the scans will be advised depending upon her condition. So there we cannot give a definite number, but yeah, in a low risk pregnancy, usually about 3 to 4 scans is what is advised.
Oh, nice, ma'am. And last, one more question, last but this one. So you have told about certain we have they told that certain injections are given in pregnancy to prevent this preterm birth. What are there, and are they safe, and when they are given?
Right. See, when we are talking about preterm birth, usually we are talking about deliveries that happen before 34 weeks. That is roughly about 8.5 months in our regular language,
Yes.
the layman language. So what happens is, when the baby is born at this point, they are not fully developed to equip themselves to the natural environment. So we are just trying to make them more acclimatized to the surroundings. So the injections which are given are called as corticosteroids. These are injections that are given because they reduce the risk of the baby having breathing difficulties once born, or it also reduces the risk of bleeding in the brain. They have a neuroprotective effect, and in the long run also they decrease the developmental delays. So mainly what they do is help in maturation of the lungs. They have a neuroprotective effect. So these are usually advised when an emergency or a premature labor is happening, that is before the tenure, before 34 weeks. Usually 2 injections are given 24 hours apart.
Oh, okay. Yeah, ma'am. Thank you. Thank you so much for coming and having such a lively interaction with us, and answering all the queries of the viewers also. And we are very delightful and very happy to have you here. Right from ma'am has come right from Vizag to have this interactive session with us. So we are very warmed welcome you, and you had a very good stay also, I think so, ma'am.
Thank you, Ruhi, for having me here.
Thank you.
I hope we really helped the viewers.
Yeah.
And in case you have any questions, please feel free to leave in the comment section. We'll definitely get back to you.
Yeah.
Yeah.
Thank you, everyone. Thank you for patient hearing. And if you have any queries or any questions to be answered, you can just post in the comments, and there will be we'll be answering that. Okay. And you can follow us on social media and website, social media pages and the website. Okay. So our next session is going to be on next week as a part of our Women's Day campaign, right? That will be like silver lining matters for the next generation. So we will hear talk in the next session, right, ma'am? Thank you once again for having such an interactive session.
Thank you, Ruhi. Thank you, all the viewers.
Thank you everyone.
So let's stay strong and healthy then.
Yes. Because today's talk all went on that how to stay strong and healthy, and how to
No, I really think women should prioritize their health. What happens is, they are so stuck up in their day-to-day routines, taking care of the family members, their children, attending to their work priorities. They somehow don't care about their health.
Yes.
Right? So please, women, prioritize your health.
Yeah, that's the main theme today, that how to prioritize your health and stay strong.